This procedure video will take you through the techniques of placing a hard cervical collar and then proceeding to performing a log roll on a patient. These tasks could occur in the exam as procedures on their own, as part of a full trauma scenario, or perhaps as part of a teaching a medical student scenario.
With an assistant holding the head, we can measure the neck in terms of fitting a hard collar. We feel this by convention from the inferior margin of the mandible to the superior portion of trapezius, and this is measured just roughly with your fingers.
Having measured the patient's neck, it is now important to size the collar appropriately. There are quite a few manufacturers of cervical spine collars, so it is important to check which you have in your own department. Generically, all collars will have a stud to measure from and a measuring line to measure down to. Please take time to ensure that you've sized the collar correctly, as an ill-fitting collar can actually cause more harm than good. Before placing a hard collar, make sure that you have removed any jewellery, including necklaces, earrings, and even tongue studs, as all of these things will be visible on your plain films and may obscure important pathology. Only now can you proceed to actually placing the hard collar onto the patient themselves.
With the assistant supporting the head, the hard collar is then placed, the velcro folded under while sliding beneath the neck. Bringing the collar in place, reminding the assistant to keep restraint of the head and then applying the blocks. And now the sleeve can be applied over the top of the apparatus. Now apply the tape, making sure that it goes onto the hard surfaces and not any of the movable aspects of the bed. One piece going across at the chin level of the hard collar. And the other piece passing over the level of the forehead. Once the patient is secured, you can ask your assistant to let go. We're now going to demonstrate the log roll procedure. At the head of the bed, I'm supporting the head and also holding onto the shoulders of the patient. And I get my team, 3 other people, to assist in the rolling of the patient. By convention, the person at the head end is the tallest and decreasing height from there. So the first person who would come in would place 2 hands over the patient, over the chest. The second person will place the hand closest to the head of the patient, over, and the other hand under. And the third person place both hands under the opposite leg. At the head of the bed, I'm in charge of the roll, so I'd start by giving the instructions. We'll be turning this patient 90 degrees to their right hand side. The instruction will be ready, steady, roll, and we'll roll on roll. Ready, steady, roll. At this point, the examination could proceed, and after that, then we give further instructions. We'll be rolling back, same instruction, ready, steady, roll, and once we're back in position, I'd like everyone to keep hands in their positions, please. Ready, steady, roll. Hands in positions and then releasing from the bottom, please. And then we'd ask for the blocks to be replaced and for the restraint to be reapplied.